Hi, I'm Dean McKnight, and welcome to another edition of Our Town, Taking Back Our Neighborhoods, a community outreach program of the entire operation. Before we start this program, once again, I want to remind everybody of the mission statement of this organization: to facilitate partnerships between community and businesses to fight drug use and crime through proven law enforcement, treatment, and prevention techniques. And when we talk about the marriage between businesses and the community, we're joined today by four outstanding business leaders in our community. How about introducing yourself, guys? Let's start with you, Joe.
Joe Sheetz. I'm Executive Vice President of Finance at Sheetz Incorporated.
And Michael Fiore from Leonard S. Fiore Incorporated, Executive Vice President and one of the founders of Operation Our Town.
Phil DeVorris, President of Blair Companies, and been one of the founders from Operation Our Town for 4 good years now.
I'm Rob McConnell, the Chief Operating Officer of Altoona Regional Health System, and have been pretty much with this group since the beginning. I was, I think, the last board member, but came on within probably 6 months of the founding of the organization.
Thank each of you. I know you're very busy, and I know you have terrific schedules, but this is kind of important. Over the several shows that we've done, we've heard from a person who was a reformed drug user, who now is president of Crossroads and gives Operation Our Town full credit. We've heard from other people who say how important Operation Our Town was to their organization and to what their mission is. And yet, Operation Our Town is a relatively new thing. How did this idea get started? Where did it come from? Michael, how about you?
Well, it started when I was talking to a undercover narcotics agent, and about 5 years ago, I was sick and tired of reading about in the newspaper about the gunfights. And if anybody remembers 4 or 5 years ago, there was gunfights just about every week. There were shootings at the stop signs of cars stopping at the stop sign, and the big one was when they started using submachine guns up in one of the neighborhoods. And I said, "Well, how are you guys protecting yourselves?" And he says, "Michael," he says, "we don't even have bulletproof vests that withstand these battles," and it sent chills through my body. So I asked a question. I said, "Well, how many you need, and what do they cost?" And he says, "We could really use 8 of them." He says, "They cost around $1,500 to $2,000 a piece." I said, "Go buy them." I said, "I'll pay for them." And as I started, continuing on with that conversation, we were seeing an influx in our workforce. Drugs affect the whole community, whether it's your family. Everybody has a family member that knows or has somebody that's been on drugs. Our children today, that's our future of our community, and then it funnels up through to the workforce, and having good, sound people affecting our businesses, affecting our profits and losses, and affecting the health and welfare of our employees. And if you can't run a business if your people aren't healthy, and you don't want to bring extra things to work, from the family or from outside the family. So as I started talking to my colleagues, Doug Wolf was the first one I went to, and I said, business has got to join together to take back this community. I said, this is not what we grew up in, and I don't want our kids to grow up in it. So as I started asking around, I talked to Doug, I talked to Phil, I talked to Steve and Joey, started talking to the hospital. We all started getting together. And then the spider web started to grow, because it wasn't just as simple as buying bulletproof vests. As we started reaching out and talking to experts in each segment of the community, different businesses, when you're talking to the Justice Department, the county judges, whether you're talking to the school districts, whether you're talking to housing. And as I started going to talk to some of our colleagues, and as we started reaching out through the community for financial support, one of the biggest things, one of the top priorities back then was the housing, was the influx of out of state and out of town people coming in and getting our cheap housing, and they really wanted to see us stop for that. So our first roundtable that we started through this organization was a housing roundtable, and that's the first thing we went after. And just people just started stepping up from there. And today, we went for a commitment of $10,000 a year. We ended up with 25 founding businesses. As the spider web grew, we jumped that up to 3-year commitment because we figured we couldn't do anything in 1 year. Everybody we were talking to says, well, you're wasting your money if you think you can get this accomplished in 1 year. It's an ongoing issue. So it just kept growing. Just kept growing and kept growing, and the more people we brought in, the more people that they got eager about the idea, and it's just been phenomenal. We never believed to this day that we'd be here, and most importantly, sitting here with the accomplishments of what our community has done. Not the 4 people sitting around here. It's been our community that has really stepped up to the challenge, and they're the ones making the difference between our government servants, whether it's police force, whether it's the justice system, whether it's the prevention groups, no matter what it is. They're the people that are making the difference, not us.
That's terrific, Michael. Thank you. Joe, so this wasn't an idea that we borrowed from some other community. This actually started here. Is that correct?
It did. And as Michael said, I remember the first real official meeting we had. We had a lot of conversations, but the first official meeting we had was the 3 of us in Phil's office. And we had a piece of legal paper, and we were just writing. Michael had brought some notes, but we were just writing down names and who we were going after for the funding, because we knew from the beginning that, it wasn't all about money, but if we didn't have that put together on the front end, we really didn't have anywhere to go, because we knew that that's the way it needed to be. So it was very much it was almost like an entrepreneurial venture when people are sitting around writing a business plan, and we were sitting around saying, okay, before we know exactly what we're going to do, are we sure we're going to be able to get enough people interested and pull this off? So put all of our contacts in, and fortunately we have enough different ones. A lot of them overlap, but we have a lot of different contacts, and kind of got started that way. And we had no model. We had nothing to borrow from, and we were flying by the seat of our pants for sure for the first year. But we had a lot of good help. The Attorney General got involved as kind of an advisor at one point to just help us figure out how we were going to do this. And then there were so many people that were doing great work already in the community that work for nonprofit groups, whether they're like government groups or just strictly nonprofit, and they were just dying for something like this to come along, because they were doing great work. They had the skills, they had great ideas. They didn't necessarily have the business contacts. They didn't have the resources, not just money, but other resources. So it was actually, at the end, much easier than it sounds like it was. Without a plan, and then just slowly putting it together, it just picked up momentum, as Michael said, and it just went. And since then, we've been, and we probably all have, I know we've had it as a group, but we've been approached by other communities just to say, how do you do this? What is the blueprint? And we certainly can explain to them what we went through and how we did it. But the thing that I think they struggle with is how do you get something to come together that quickly? And I think Blair County and Blair County's business community is a lot different, and it's so tight that it was able to happen very, very quickly. And I think a lot of other places, that's their uphill battle, is how do they get everybody together that quickly?
That's wonderful. Phil, I've heard about this round table. Tell me about this round table. What does that consist of, and what does it do?
Well, going back to that initial meeting that Joey mentioned, we talked about people that would get involved in the business community, but we said, look, that's the group that we can reach out to very quickly as business people. And we said, well, is that going to be sufficient? Because collectively we employ 10,000 people, tens of thousands of people. And we said, that helps, but that doesn't get it done. Mike talked about a web, and it's really a community-wide web that really is all of the interconnections that we work in. And we said, look, in order to get around this problem, Michael's already brought law enforcement in, and that's what drove us to talk to Tom Corbett. And there he is, the top cop in the state at the time. And the first thing he says is, law enforcement can go in and we can halt this and we can really interrupt this drug traffic, but it won't make a difference And we said, what do you mean it won't make a difference? I mean, you're the guy employing all these cops, and you got drug stuff going all over the place. He said, it'll only make a very temporary difference. To make a longer-term difference, you have to get prevention and treatment and get the message out there, because law enforcement can't do that alone. And that's why we immediately came back, did the brainstorming session, and said, hey, we need to find key business leaders that can help, but we also need leaders from every aspect of the community that touches the drug traffic. And that's when we looked at it and said, well, why don't we organize then a steering committee, and we can have roundtables that will focus on each aspect. Well, we already knew we needed law enforcement and judicial, and those were naturals. Everyone thinks of drugs and crime that you needed. Well, who else did we need? Well, Michael said, well, we better get housing involved, because one of the things we got are improving our housing and getting rid of some of the blight that gives a foothold and adds to the despair is an important aspect. And housing got on board really quickly and helped. But we said, well, what else? Well, we better get schools. We'll get, secondary education, primary education. And we brought those people to the table. We said, wow, there's a lot of outreach programs going on. As Joey said, there's huge outreach in the community already, because our community got such a tight web, and a lot of that was faith-based. So we said, great, let's get representative faith-based. And from one after another, we've added pharmacy, retail, anyone that's affected. And in a community like ours, everybody's affected. And that's why it's been effective, because everybody's effective said, yeah, I'll come to the table, I'll get up people in my industry, and we'll come help.
That's wonderful, Phil. And Ron, tell me, that the health industry, I mean, our hospital, I think we have one of the finest medical facilities for a town and an area this size. I mean, I'm an old man, and I really depend on our medical facilities. And we just have a terrific cadre of doctors and resources available. But how did you guys realize that this was a need for you to participate in?
Well, like I said, I sort of came to this group late, less on the private entrepreneurship side, but more on the hospital side. And I welcomed the invitation to be part of this group, because I think the hospital is an intricate part of this whole web. When you're in the hospital every day, like I am, you see firsthand the devastation that's caused by the drugs. You see the overdose victims. You see the vehicle accidents that result. And we also have a lot of our folks that are dedicated to the education side and the prevention side that I think we were able to bring to the table and sort of round out the vision for Operation Our Town. I think when Michael first had the idea, and then it sort of began to develop and evolve, I think it was then that, as Philip said, it became a much bigger web. And I think we, as a hospital, were able to bring some of those community resources. We're obviously involved, unfortunately, in many of these aspects that do affect. And the other thing is, we were seeing more and more babies being born with drug-addicted infants. And so, I'm proud to say that 3 years in hindsight, a lot of this, the numbers, when you look at the statistics, have improved greatly. But I think that's the resource that myself, as the chief operating officer, but also the resources the hospital could bring, and then sort of round out this group, I think. So we're very, very glad to be involved.
Well, and that's terrific. I'll tell you, you mentioned the babies, and I think, we're setting the stage. You guys are setting the stage for the future of our community and what's going to happen here. What has been the community's response to Operation Our Town, Michael?
It's been fabulous. It's actually been overwhelming to some extent. Like I said, we never thought we'd be where we're at today. But we one of the first in the first year that we started, one of our first partners that came on board with us, and it was really done through the community surveys that the United Way runs. And the United Way was doing their surveys for the community to figure out what the issues are of the community. And the number one issue that came back was drugs and crime. And the United Way had never had an outlet to get involved with that. Mm-hmm. So they jumped on board right away within the first 6 months of this organization, and provided a match of $50,000, and then went out and also helped us raise another $50,000, and we did a phone-a-thon. And the phone-a-thon was very successful, and we still today, 4 years later, receive checks from private citizens, whether it's $5, whether it's $20, whether it's $500, different small businesses, organizations, all the social organizations around here. We've partnered with so many of them over the last 4 or 5 years, like the Curve, the United Way, the Lions Club. I mean, just on and on and on, and continue to get their support, but not just their financial support. You talk about personal stories. Within the first year of that phone-a-thon, one of our law officers was on the phone, running the phone, and a woman called from up in Phillipsburg, an elderly lady, and had said that since this group has gotten together, she feels much safer coming down to the mall, and how she feels protected and not as feared of coming to shop in the Logan Valley Mall because of what we were doing. And she wanted to contribute $5. That's all she could afford. But I mean, that's every week, every month, and it just continues. It's amazing.
Michael, thank you. Phil, your company, the DeVorris Group, has several different. What has been the response to your organization and your people to Operation Our Town?
It's really been positive. As Michael said, from a community standpoint, we look at our employees as a team, as a large family. I mean, it's one of the things that we hold together, and I hear about it when I'm walking amongst the folks at work, the same as we do in the community, which is I'm really happy someone's getting involved. I'm proud that our company's doing it. One of the groups, when they were just doing company shirts, put Operation Our Town patches on the sleeve when they were making them, and it's really nice because they want to be part of it. And you see, whether it's the bumper stickers or the patches, that aspect of the community, it's the accessibility and the reminder that, hey, it's not the school districts who got lots of their own problems and law enforcement who got a tough job. It's everybody recognizing the fact that, we are all in this thing together. And that's why we do a steering committee that brings everyone together. And law enforcement has told us, the same as my employees have, that they feel much better connected. And as a community, when it's better connected, we're all a lot healthier and happier for it.
That's terrific. Joe, very quickly, your stores touch many of these very communities. And how about your employees? What have they said about Operation Our Town?
Yeah, I mean, much like what Phil said, I mean, I think to them, not only were they very happy that the company was getting involved, and it makes you feel good about working somewhere that has that love of the community, but they were living it and seeing it too. I mean, a lot of those people that we're talking about when things were bad were in and out of the stores. The police were in and out of the stores looking for people. Hey, was so-and-so in here? Here's a picture of somebody. And so they were feeling it on that end, on the retail side. So they had much the same, response, which is, this is going to be a tremendous thing, and a little difficult for them to get directly involved, but we did have a lot of them do things like get involved in the community cleanup days, some of the volunteer work that was done, and some of our people at corporate helped with coming up with the name and coming up with the logo. So different people from different, parts of the company certainly jumped in.
Joe, I'll tell you, ladies and gentlemen, we've been discussing this morning how Operation Our Town was founded and the people that put it together and the response in the community. And these are 4 of those leaders, 4 people who have the same kind of love for this town that you and I have, and the same kind of desire to make this a better place to live. We're going to be back in just a moment with some more fascinating conversation.
Some banks say they're part of the community. Mainline National Bank helps build it. Volunteering, financing homes and business, being there for our neighbors when they need us. Since 1944, it's what we do. Operation Our Town has helped to reduce drugs and crime in our community. Mainline National Bank encourages you to take back our neighborhoods. Go to wearecentralpa.com and click Operation Our Town to learn more.
Ladies and gentlemen, welcome back. It's been a fascinating morning for me because these are four gentlemen that I respect so much. I know how much they have contributed to this community, and I know how much it means to them. Ron, tell me, do you have some personal success stories from Operation Our Town, and what's it done to your organization at the hospital?
Well, the number of people that come up to me in the hospital and recognize our involvement is phenomenal. Probably one of the more poignant stories that I recall was there was a lady that lost her daughter as a result of an overdose, and she was aware of my involvement with Operation Our Town and others, and she basically after she lost her daughter and the funeral and everything, she came to me and she said, the only hope we have in this town is Operation Our Town. And it sort of struck me as sort of how important it was, what we're doing. We have fun with what we're doing, and we take it very seriously. But I don't know if we always recognize just how important it is for someone who has a drug-addicted son or daughter or parent. There's numerous stories like that. But that woman's story, the way she lost her daughter, was not very, very well, I guess. It was not an easy death, and she came up to me and said that, and I thought, this is really we are connected to the mission of what we're trying to accomplish here, and I think back to the earlier segment when Michael talked about the community outpouring, I think we hit probably what was a peak in the community of sort of being fed up with what we were seeing in the community. And I think when I got involved, 6 months after these guys got involved, I think it was the main feeling by all of us was, and all of us grew up here, was the fact that we wanted to remember this place and make it like what we grew up with. So that's actually how we came up with Taking Back Our Neighborhoods and our sort of beautiful looking logo of how we want this place to look again. We have a lot of work to do, but I think that was the vision. The vision was, we've had enough. And I think the lady that Michael referenced calling from Phillipsburg is a good example. It's not about the corporate donor for $100,000. It's about everybody in the community saying, that's enough, because we outnumber the bad people. And we outnumber the drug dealers, and we outnumber those that are addicted. And so it's about time we get involved. And I think, that's the sort of response. When we had the first telethon from the United Way, it was amazing, the number. I mean, it was like a Geisinger telethon where you just had people calling in to support the kids. We had people calling in to support the community. First time ever. So it was a really good response. So I think, back to your point, I think all of those things are mission critical for us as we maintain our focus on trying to do what we're doing.
Okay. Philip, tell me about the news media. How did they embrace this idea and project?
So many things are said about the media that blast them for only putting the sensational gunshots at the time on the front page, and then if they don't do that for a while, then they get blasted for not covering on the evening news some other story. It's a very delicate balance they all work, but they stepped up to the plate and helped in every way they possibly could for Operation Our Town, and I believe that they did it in part because it's their job to cover the news, and this is important in the news. But I also believe that every one of the media outlets looked at this as being part of the community and that it was an important thing to do. And so I believe that they stepped up in a much broader sense to help make sure that the word was out. And I've talked to people, as Joey said, from other communities that have wanted to emulate it or talk about it. Half the communities, probably 3/4 of them, they suffer from the ostrich syndrome. Wow, I didn't know you had those kinds of problems in Altoona. I mean, I just shake my head and think, well, there's an ostrich. There's someone saying, well, that could never happen in my community, could never happen in my family. And, I think our media helped get that message out. Sure, I don't think our problem was worse. I just think that it was out there. And I think that by acknowledging it, allows it's a first step that we can work. I worry about it for my own family. I don't say I'm here to help Michael's family or your family. I worry about my own family, my own kids, and my greater family and my company. And I've had incidents, unfortunately, just like what Ron mentions, kids that I knew growing up, people worked with for 20 years, and those stories getting out there are important. And you just say, thank God it hasn't come any closer to home, but I have to stand up and do something. And we're fortunate to live in a community where everybody stands up and helps.
Phil, and I know your family, kids are great and beautiful, and it's good to hear you say that. Ron, do you have any small children?
I do. I have and I think that's part of all this is we all have children. We all think about our own children and everyone else's children, and I have a 13-year-old and an 8-year-old, and I think one of the big differences from when we all grew up was there were drugs when we grew up, but the drugs didn't have the same impact they have today. When you think, when we look at it medically from a hospital perspective, heroin addiction can happen virtually immediately. And the risk of kids trying drugs today from the addiction perspective or from a death perspective is reality. And so the last thing I think any parent in this community wants is that God-forsaken loss of a child who tries something for the first time. So, we have as much responsibility on the law enforcement side as we do on the education side to say to these kids, look, we're not making this up. This is real stuff. You guys try this, you can die. Tomorrow you can die. And, I know with kids and trying to get that message across sometimes is challenging. But I know even in my own family, I drill it into my kids pretty hard, and you pray and you hope. But I think that's the other obligation we have to the community and why we're doing this.
And Joey, I know you have 2 young people. Will you tell us about your children?
Yeah, much the same as Ron. I have a 12-year-old and a 15-year-old, and that's what you worry about. And I think Ron made the perfect example of, we did grow up here, all 4 of us, not that far apart, age-wise. And there were certainly things around then, but nothing like there is now. And so it's almost to the point. We got so educated in this process. I think we knew there was a problem, obviously, enough that we decided to get this group together. Within 3 months, I learned more than I had learned in the 40 years prior to that, because you spend time with people who are doing treatment programs. You spend time with all the drug enforcement people, and you start to learn about things you didn't even know existed. We certainly knew there was a heroin problem. We knew of other drugs like coke. You start learning about all these different things and how prevalent they are, and just how young some of the people are that are getting involved. And it was extremely eye-opening. And you just, right away said, how can we make everybody understand this? Because, it's not like I had my head in the sand. It's not like I didn't read the paper or didn't do whatever, but just that short period of time. And certainly, like Ron said, all of our kids probably get hammered more than most, just because we're so close to it, and we want to make sure that they understand the things that we've learned.
Michael, I'm going to ask you about your personal family, but I want to tell you that your extended family has more signs in this community than Sheetz stores.
No, I don't know about that.
You got the Fiore automobiles, the Fiore constructions, the Fiore, you got Fiores everywhere. Tell us about your family and your extended family.
Well, I think, I was just thinking about the history of this, and I think there's one important part that I leave out, and that was when I sat down, when I come up with this crazy idea. Before I ever ventured out to talk to anybody else, the first thing I did was went to my father and my 2 brothers. And I sat in a conference room with them and explained to them my ambitions. And my father looked at me and said, "Are you crazy? How do you think you're going to pull this off?" And I said, "Dad," I said, "if I can't do it now," I said, "I'm in the prime of my life." I said, "I'll never be able to do it." I says, "This is our community. This is what we stand for. This is what we got to stand up and fight for." And my brothers looked at me the same way. And, that was when my father had about a year left to live. He's not around today to see the success, but I know he's watching over our shoulders. And I have a lot of hope in this community, because this is something that's going to be an ongoing battle. It is not going away. And one of our struggles today is looking at where our organization is, and where do we want to take it, and how are we going to keep it to, how are we going to continue that support. And from back to your original question with my family, I have 3 boys, and I have a huge network of nieces, nephews, great nieces and nephews, and we all live in this community and go to the schools, go to the churches, participate in all the different programs, the social things, and that's who we are. We are all about family. And whether it's my family or somebody else's family, because I have good friends, we all have colleagues that have had children that have been sucked up in this drug world. We grew up in it. It's totally different than when we were growing up. And what's amazing today is how the drugs change. We've taken over 50% of heroin off the streets in this county. It's an amazing feat. But we continue to battle that. But as we do that, our pharmacy roundtable got energized, because what happened is they went from heroin and now they're going to prescription drugs. You started to see our pharmacies being robbed. You started to see them going down through the roofs. I mean, these guys get creative. And now it's K2 and it's Blizzard and these meth labs, and that's something we need to talk about a little later probably in the program, because it's an ever-ending battle. And our community has to be committed to continual support. We cannot turn our heads. We cannot let our guard down. We got to continue to fight this battle.
Michael, I'd like to address our audience for just a minute. You've just heard the need for community support. You've heard about the need for funding, and you've heard about the terrific success that this organization has had. And it now depends on you. These guys have done their job. They've put together an organization that can really have an impact on this community. But you too can have an impact. How about sending a check? How about volunteering your time? We've heard on these programs about Operation Cleanup. We've heard about the graffiti problem. We've heard about so many things. But you can do something. If you can't physically help, send them a check. We heard $5, $1, $50. That's what's going to make this whole organization last until hopefully someday this problem is solved. And I don't know how that's going to happen, but you guys, I just can't tell you how much respect I have for your organization. I heard Rennie Santone, our fire chief, say a couple days ago that arsons are down, and he attributes that to the work of Operation Our Town. And Phil, in fact, Joe, talk about finances for just a minute. How much money does this organization need every year to sustain itself?
Well, there's probably 2 different questions there. I think the money to sustain ourselves is something we have covered pretty well with the core group of companies that were the founding companies that are still involved. We were fortunate along the way to pick up some federal money, some grant money, which we could then use to supplement the local money that we raised. In the early years, it was a road show. The first year or 2, it was one of us going to every Kiwanis Club, Lions Club, Rotary, you name it. Just explaining what this thing was we were going to try to pull off. And there was a lot of momentum because of all of that, and we certainly got a lot of early funding from that and from the United Way Telethon. As time's gone on, I think people have read about the success, and they get to see in the paper, because certainly the law enforcement people do a great job. Anytime they're going to do any kind of major operation, you'll always see at the end they'll say, and we did this with the help of Operation Our Town. So they continue to give credit to us for funding a lot of their activities. But I think in some ways that almost works against us, because I think some people start to look at it as, well, their job's over. They've already done that. They probably don't really need the money anymore. And it's just the opposite, because we came out with a heavy dose of law enforcement because we knew that's how you could make the quickest impact, and we knew that's how you could get the most the name out there the easiest. And then we followed up with all the prevention programs, which is what we've been spending a lot of time and money on for the last year and a half. And there's a constant need for funds there. I mean, we get all these requests, and one of the hardest things we do as a group, and there's a committee that handles it first, and then it comes to the four of us, is you look at all the people and all the really great organizations that are requesting funding, and we can't say yes to all of them. We can't even say yes to all of them that deserve it, because we only have a certain pool of money each year to be able to use for that. So, yeah, we can sustain ourselves, but to really continue to make the impact and to make it greater, we need to continue to get more funding and sources and more people involved.
Joey, thank you. We'll be right back with some more exciting dialogue with our four guests who have certainly brought a lot to this table, and I'm learning something. Thank you very much.
Some banks say they're part of the community. Mainline National Bank helps build it, volunteering, financing homes and business, being there for our neighbors when they need us. Since 1944, it's what we do. Since 2007, Operation Our Town has helped to reduce drugs and crime in our neighborhoods. Operation Our Town was founded to combat a deteriorating community riddled with drugs and resulting crime. It was believed that if the citizenry worked together to improve our community, we could literally take back our neighborhoods. Our mission: to facilitate partnerships between the community and business to fight drug use and crime through proven law enforcement, treatment, and prevention techniques. Efforts are designed to help strengthen existing organizations within our community so that they may serve and accomplish more. From 2007 through 2010, Operation Our Town raised over $2 million from area businesses, organizations, individuals, and federal grants. Over $1.5 million were distributed to local law enforcement treatment and prevention programs. Since 2007, drug arrests increased by 30%. Calls to push out the pusher increased 47%. Drug overdoses have declined by 41%. Everyone in the community is affected by drugs and crime, but maybe no other group is affected more than our children. We must keep our neighborhoods safe and lead by example to show them there are alternatives. Mainline National Bank believes we have a community worth preserving for our children's future. Mainline National Bank encourages you to take back our neighborhoods. Go to wearecentralpa.com and click Operation Our Town to learn more.
Ron, let's start with you. Let's talk about the future. What do you see happening as we go down the road here with this group and organization?
Well, I think there's a lot of facets to how the organization needs to adapt and to the changing drug problems, as Michael referred to earlier. One area in particular that I think a lot of us are interested in is when the organization was originally created, the vision was multi-pronged, but one of the thoughts was could we reduce a lot of the blight in the Blair County, greater Blair County area, because of the recognition that a lot of drug dealers that come in from the outside use many of those types of properties and homes. And so I think we're embarking on a new venture now to begin to really take a look at that issue, how we can help solve it, I guess. It's another complex problem. It's going to take some money to do that. But I think it's anybody who's ever seen a blighted area, for instance, in the city of Altoona, that's seen that blighted area get cleaned up, sort of knows the impact that has on the community right nearby that area, as well as the overall area. We're interested in that, obviously, in areas around the hospital. Around the hospital, we have some very blighted areas. But I don't want to just focus it on that area. It's really the entire area for the good of the community. So I think we're going to see some efforts in that area.
Ron, thank you. I've heard so many stories about that area and how much they need, how much effort they need. People that want to help themselves but just need a little boost.
Yep.
Phil, how about you?
Same way, and it all goes back to community. Anybody that's cleaned their own house knows that once it's done, no matter how long they procrastinated, just cleaned my office after 15 years, believe me, I know. No matter how long you procrastinate, once it's done, or once it's well underway, the feeling of relief and the despair goes away. you feel more positive about everything you're doing. And when we talk about improving the community from housing, that doesn't mean you have to spend $1 million to improve a street. That just means that people start cleaning up, and when they're doing it, and the first guy that starts inspires their neighbor, and then next thing you know, a whole block is doing it, and people just walk a little better, stand a little taller, and are proud of their community. And in the long run, when they keep growing in that environment, they're going to be much more resilient than the despair that sets in, because that despair is the black cloud that lets the drug dealer say, well, just try this, and that'll make you feel better. And that's not the right way to go. So it's remarkably important for the long-term health of our community.
Phil, that's a great point. Ron, I got to tell you, a lot of your doctors are telling me about some of the things I'm taking. This will make you feel better. And it has. Joey, how about you?
Yeah, just following up on what Phil said, and he essentially stole my point. But, we've seen it. We've seen in an area where you might have only had one or two really blighted properties. It might not have been an entire neighborhood problem, but those properties are taken care of, raised to the ground, area cleaned up a little bit. Next thing you know, somebody next door is putting a fresh coat of paint on their house. Next thing you know, the next house over is finally fixing that porch that's been, in disrepair for a while. It is just kind of contagious. And in some cases, it does not take a lot to make a pretty large change to that area. And that's one of the things that we've been, working on is in the very, very beginning of this blight thing. We're by no means anywhere near where we need to be. But just looking at, rather than saying we're going to take this one street, are there ways we can make a greater impact by just taking care of this, and this property, which may be in 5 different neighborhoods? But we know that it won't just be us. We will get that help. Once we can take care of one, we'll get that help.
Hey, Joe, thank you. I've got to tell you that, and to you in the audience, please stay tuned, because we're going to come back in the next segment and talk about the exciting things that are happening in downtown Altoona and the influence of these young people from Penn State and what all this means to our community. Michael, let's get back to the original question. Tell me about your opinion of this. Where do we go from here?
Well, I think back to when we first started, we talked to Attorney General Corbett, who's now the governor. He said, we can do all the weeding that you need, but it's not success until you start to seed. And I think that's what the 3 of them have been talking about, and it's about us going in and now looking at, and I'm talking to actually some, we've heard the county and the school districts and everybody fighting over who's responsible for tear downs and the raising of buildings and houses, and it's just what we need to do is we need to get grab a hold of that, and we need to collaborate and work together. And I think one of the things that we're looking at doing, and I've already been talking to some of the groups, is to put some type of land grant trust fund together to work with, where it would incorporate all the entities and come up with a solution to start looking at blighted properties throughout the county, so that we aren't fighting over it. We're working together for the same common goal, because that's, like Joey said, we need to look at not whole blocks. We need to start small and let it grow. And I'm sure it's going to be the same web like like the fighting drug and crimes. So I think that's one of the areas that we need to look at.
Michael, you're absolutely correct. Being in the banking business for many years, I recognized the importance of the government's Redevelopment Act, which said that banks couldn't redline, not that any local banks ever did, but we couldn't redline, and we needed to help people who wanted to own homes. Have a personal opinion about how far the government went, but that's just my opinion. But the fact is, we need a little bit of help to make a big difference. And that might include just reaching out to your neighbor. Maybe you have a neighbor who's my age and really can't maintain their property the way they used to. Maybe something as simple as helping cut the grass or trim a hedge or just like you said, pride in the community. And I believe if we had some way to help people buy homes and get into them, we would be way ahead in the future. Mm-hmm. We'll come back in a segment in just a minute and talk and wrap this up. Thank you.
Some banks say they're part of the community. Mainline National Bank helps build it. Volunteering, financing homes and business, being there for our neighbors when they need us. Since 1944, it's what we do. Operation Our Town has helped to reduce drugs and crime in our community. Mainline National Bank encourages you to take back our neighborhoods. Go to wearecentralpa.com and click Operation Our Town to learn more.
Welcome back, ladies and gentlemen. I'd like to call on Michael again. Michael, do you want to tell us a little more about your feelings in this housing area?
Well, it's not necessarily the housing side of it now. I mean, I think we've covered it enough because we're on a time constraint. But what I do want to talk about today is the changing of the drugs. And I think we really need to make, the public has to be aware of this. Everybody has seen it. We have the K2 that now legislation has put in and put a year ban on that. They changed the name to K3. It was such a broad legislation. They went out and changed the name on the product, and now it's called K3. You know, it's a synthetic marijuana that's being bought at our local stores here. We have the Blizzard, which is the bath salts that everybody's been seeing, and how violent, and maybe Ron can talk about how violent that is when these kids and adults are on that. And there's several overdoses coming, and you know they're buying it at our local stores. And the third one is meth, the meth labs. And we have been running some educational programs. We're trying to get out in front of this to see how we can educate the public and the community. But they are very dangerous. They're bombs that are being found. I mean, this stuff is very flammable. You've heard we've busted between September last year and January this year. There was 11 busts of meth labs. Wow. You're finding them out in the woods. You're finding them in the back room of a garage. They're very dangerous. The chemicals they're using, if inhaled at the proper time, can instant death. And then the explosion factor. And then not to say the consequences of it. So I just urge the public to really get out and educate yourself. We are going to try to do our best, but you have to, it's personal responsibility. People have to take it on themselves because this stuff is very dangerous and it's an ever-changing thing. And we're always behind the eight ball. They always get in here and then we learn about it and then we're fighting. So I think that's very important.
Michael, thank you. And you're right, personal responsibility is a big part of this. Ron, let me segue to you. And we talked earlier about prescription medicines and the fact that many of these people are turning to stealing medicines and whatever. Tell us how that's impacting the community and what we can do about that.
Well, let me answer that question, but let me just say that to Michael's point, we're seeing a lot of this in the emergency room when you talk about the Blizzard drugs, that when you see these patients in the emergency room, you're not quite sure what they're on because so many of these drugs are new, they're synthetics, it's hard to figure out treatments for them. The methamphetamine labs that are, when patients come in from those, we have to oftentimes decontaminate those people before they enter the hospital environment because these chemicals are so harsh that you can't even allow those patients into the emergency room because they contaminate the other patients. So this is a real issue for our community. And I just want to say that we collaborated a number of years ago on the Push Out the Pusher line, and I think it's important for the community to recognize that if they call those numbers, there's always someone live to answer if you want to talk to somebody. There's also the ability to record a message. But if they have information about this from a law enforcement perspective, it's critical that they call and tell us about it because that's how law enforcement has a sense of what's really going on. To your question of the impact, I think we see it every day in our community with regards to the robberies, the pharmacy roundtable, which was put together. Our pharmacy folks participate in that. it's interesting because it's almost, to Michael's point, as fast as you stop something, there's an adaptation that they try to do something else. So I think, you know, as we perpetuate this organization and continue to do what we need to do for the community, we need to be adaptable. To Michael's point, we weren't ready to do and take care of the drugs that he just talked about 2 years ago because they weren't maybe an issue or weren't here. So it's a very challenging game, but it's very, very important for the community to call in, let us know, and they're not letting us know, they're letting law enforcement know what's going on in their community, because that's really how we stop it.
Ron, thank you. Last evening, about 6:30, I drove through downtown Altoona, and I saw young people on the street. And it was really exciting.
Yeah.
And it dawned on me that Penn State is having an impact on our core areas. Penn State, Altoona. Joe, is this good for us? Does this create additional problems? Tell me about it.
I think it's fantastic for us. I mean, you're looking at a corridor downtown that, and obviously a lot of it was probably before I was even born, but you know, seeing the pictures, hear the stories, I mean, it was the place to be. It was the place to be not only in Altoona, but, you know, probably within 100 miles of here. And we've all known the struggles of, you know, downtown and trying to revitalize downtown seemingly for, you know, 20 years or so. Mm-hmm. And there's been some limited success here and there, but this is the first kind of, you almost feel the cultural transformation, which is the first time I've felt that downtown. And you're right, there's a lot of young people, and there's a lot more to come because of the other buildings that they're adding. And much like we talked about with Blight, once somebody does something, other people just start to naturally kick in. I think that's what you're going to see. You're seeing what Penn State's doing. There's no doubt you're going to see other companies come in, take over other properties, start new businesses, build new housing. And that is the core. That is the middle of town. And I think that is just a wonderful opportunity to make a change that will feel, you know, throughout the whole county.
And also an area that traditionally we think of as being crime-ridden and having additional problems, but they're gone. They seem to be gone. Phil, am I correct?
Absolutely. We talk about seeding, and part of this is reaching out to kids, and part of this is work on a community. The more of that happens, the more positive it is for all of us.
Well, Dean, I was just going to say you know, the healthcare system in partnership made a very large commitment to the Station Medical Center.
Wow.
And just a great example of all that. That's about a $25 million investment in that whole complex now that is virtually, you know, full. No tenants there, no empty space. And that has totally transformed. If you remember back to the 80s, what the Station Medical Center, Station Mall then was like, that's how we envision, I think, downtown Altoona looking very shortly. And you know, when the hospital made the commitment to stay where we are, when we merged the two hospitals and consolidate to the Altoona Hospital campus site, I think that again provides a great core for revitalization of any of those areas, including downtown where Penn State is.
Thank you. Gentlemen, go ahead.
Well, I just wanted to add on that. I think that whole corridor there, and you know, from the Station Medical Center to where going through downtown Altoona where Penn State is, and then when you start going down towards 8th Avenue, you have the Altoona Water Authority, you have Dr. Slepko that just, you know, on through to the hospital. So that whole corridor, and that's the seeding that we want to see. That's providing opportunity for our kids.
Joe Sheetz, Michael Fiore, Phil DeVorris, Ron McConnell, thank you. I want to tell you, this has been so inspirational to me. I know each of these gentlemen's parents, and I know how much they've meant to this community over the years. But I got to tell you, I feel like maybe now they really mean a lot to us. If you haven't supported Operation Our Town, pick up the phone and make a phone call. Make a contribution. Call and volunteer. There's something for everybody and a need for everyone. Thank you.